Today, December 1st, is World AIDS Day, and each year, on important days of awareness like today, it's good to check in with those who are at the forefront of dealing with the HIV epidemic that has plagued Australia along with the globe since the 1980s. Joining us on the show is Darryl O'Donnell, the CEO of the Australian Federation of AIDS Organisations. Darryl, welcome to the show. Can you please tell us all about World AIDS Day?
World AIDS Day is really a moment of reflection more than anything else. We've lost so many people to the global AIDS pandemic, more than 37 million lives lost over the last 40 years. So first and foremost, World AIDS Day is a time to remember all the people that we've lost, all of our loved ones. But it's also a moment for us to reflect on where we're going in the response to the epidemic. There's such an incredible mobilisation of effort at a community level, among scientists, among clinicians, among governments, that really, this is when we take stock and look forward and say, right, where are we going from here and how can we bring this epidemic to an end?
Let's talk numbers and data. How are we as a country doing when it comes to HIV in Australia?
Well, Australia actually has a really good story to tell about HIV. We really jumped on the epidemic very, very early in the 80s. And what it's meant is that we've actually had been able to keep our numbers in check and actually keep reducing those numbers over time. So last year, for instance, in 2021, we had the smallest ever number of people diagnosed with HIV. That's 552 people, and that's about a half of those diagnosed 5 years previously. And so we're seeing this really nice reduction in HIV diagnoses over time, but we've still got a way to go.
That's fantastic news. How much of that do you feel has been affected by COVID and lockdowns?
It's certainly a factor, and at this stage, we're sort of emerging from COVID, but in that 2021 data, last year's data, obviously there were still lockdowns in different parts of Australia. So is there something sort of hidden in the data? Are we worried that there might be an increase? There's certainly concern about that. But the overall trend of decline is absolutely real.
Australia has a commitment to end HIV transmission by 2025. Are we still on track to achieve this?
2025 is getting very close.
It is.
It's really getting close now. But actually, we can do this. It's part of what's so exciting about working in the HIV response today. Whether you're a GP or a community worker or a researcher, that Australia for all of the concerns we have about Medicare and about access to a GP, we're actually better placed than anywhere else in the world to really drive ourselves towards an end to the HIV transmission in this country. So 2025, it's really short time frame now, but we do believe that we can get that number of diagnoses, 552. We can really drive that further down over the coming few years.
The world was inspired to work together during the COVID pandemic to work on the vaccine. The scientific community was astounding when it came to working together. Has that drive continued into or had any impact on the fight against HIV?
Well, I think it's, wow. What is possible when there's a sort of a global commitment, when countries are working together is quite astonishing. And I think we saw in science in particular that when the world faces unprecedented challenges, it can really step up. Our scientists and medical and clinical leaders, they can really step forward and achieve some incredible things. And we saw that in COVID. It means that when we're talking about something like HIV, we know that that science is what's going to get us to an end to HIV transmission. I think one of the really big differences between COVID and HIV was, in COVID, we got very quickly to this point where a vaccine was on the radar, where we were all sort of able to step forward and to get those first doses. Whereas, we're 40 years into the HIV epidemic now, and today we do have all of the tools we need, whether it's condoms or whether it's pre-exposure prophylaxis, which is a prevention pill people take if they're at risk, or we have effective HIV treatment. But it took us a long time to get there, and so we've really required a lot on people not assuming there's some sort of magic solution that they could but really making choices in their lives about how they're going to keep themselves safe and how they're going to keep their partners and loved ones safe over a very long period of time.
Every couple of years we hear in the news that we're one step closer to finding a cure for HIV. Now, as far as I understand at the moment, once you have the infection, your body can't get rid of it. How close are we? Is there a chance of a cure, or should these sort of news reports just be taken with a grain of salt?
Always a grain of salt. I think some of the news reporting about cures and the search for a cure on HIV, they can actually be quite distressing for people who live with HIV, because of course, whether we're living with HIV or we're friends or loved ones of people who live with HIV, we want nothing more than the day when there's going to be a cure. Even though we've got a great effective treatment, the cure is the holy grail. That's what will finally end the epidemic globally. But we're still a long way off. COVID, interestingly, has helped us a lot. And, by opening up new avenues for research into a HIV cure. But in fact, COVID research was also helped a lot by a lot of the work that's been done in HIV. So hopefully that pushes us a little bit further forward. But we're still a long way away from being able to say there's an effective cure for HIV on the horizon.
The previous health minister, was it last year, announced a $39 million grant to provide HIV treatment for people ineligible for Medicare, and $11 million for the continued work of HIV organisations such as yourself. Has that support continued with the new federal government?
Yeah, in fact, those were really important announcements on World AIDS Day last year. And of course, in May this year, we had the federal election and a change of government. For AFAO, we work across the parliament. It's very important for us to make sure that we're continuously educating and building awareness and maintaining commitment with our parliamentarians at a federal level. And so regardless of whether there's a Labor government in power or a coalition government, that we know that there's understanding on both sides about the epidemic and about the challenges ahead and how we need to solve those. So we've done a lot of work with Labor in the lead up to the election and through the last parliamentary term, and have been really delighted to see the strength of their commitment on HIV. I think there's so many things that are on the desk of a health minister federally. So many challenges that are in front of them. But on HIV, because of how well Australia has done to date, and because we now have tools like PrEP and HIV self-tests, it means that there really is an opportunity for this minister, Mark Butler, to drive Australia to be this leader in ending HIV transmission.
Is there anything, before we wrap up, is there anything that you feel is important that people should know today on World AIDS Day about HIV and AIDS?
The most important thing is not to be frightened of HIV. We have all of the tools to prevent HIV, to test for it if someone might have been at risk, and to treat it effectively if someone has HIV. So we're in a really exciting, really new age for the management of HIV in our community. But perhaps most importantly on World AIDS Day, for us to think about the impact of the epidemic on so many people around the world and here in Australia. That impact has been felt particularly in the gay community here in Australia. And for people with HIV, there continues to be, as you've talked about, this kind of stigma that attaches itself. Many people with HIV, are considered, they're careful about who they talk to about their HIV status because of that fear that someone might not react well. And that's not an unfounded fear. We see in the most recent survey, around 1 in 4 Australians say that they would treat a person with HIV negatively if they knew that that was their HIV status. And that's still a distressingly high number of people who have no reason to fear or to be concerned about a person with HIV, but are still, prepared to behave differently, negatively, towards that person. So the message on World AIDS Day is to reach out and to be curious, to be educated, to be informed about HIV, and particularly to make sure that all people with HIV in Australia feel supported and understood by the Australian community.
Darryl O'Donnell, CEO of the Australian Federation of AIDS Organisations, thank you so much for your time today.
Troy, it's a pleasure. Thank you.
The Troy Murphy Show, driving you home Thursday nights from 6 p.m. on 2SR FM 99.7.